trusts that are research active are higher performing across the board.
A couple of the consultant psychiatrists were happy to involve me in one of their research projects. So it gave me opportunity to do a bit of data collection, understand the research basics.
As well as learning as a novice with research really, as well as learning about all the different elements that are involved with research, with my own project that I'm doing. I've had opportunities to work with alongside researchers, to be involved with the clinical research academic network for East Midlands.
So that sort of led on to ideas around a research project, and I thought I could do a PhD to get the required skills to actually do high quality research, which in the end I was hoping would improve patient outcomes and the quality of care.
So I think,
Everyone's talking about research. Could LPT be the place where you realise your research ambitions?
we can just work with that same.
There's a whole range of roles that people can have within the trust. So for example, we enable our service users to be participants in studies, and these can be national studies that are on the National Institute for Health Research portfolio. On average, we have 30 to 40 of these studies per annum, and we could have between 500 and 1,000 individuals being participants on those studies. So staff can help by signposting the studies to our service users, by raising the profile of the research, and also by being involved as perhaps training within this study. There's many different roles that they can take. What they can also do is be advocates for embedding the findings of those studies into practice. And we've got examples where we have been participants, we've supported the delivery, the actual doing of the research, and now we're using that evidence into practice within our services. So if somebody doesn't want to be doing research but wants a role in embedding research into practice, there's many things they can do. If somebody, however, has the aspiration to do research, build their skills, build their capacity, drive some results relating to questions within practice, we have a breadth of support we can offer, and people can do that at master's level or even doctoral level. We're aspiring to support staff to be successful at postdoctoral level as well. That means we help build up collaborative networks for people, that they link up with appropriate academics, build networks that enable collaborations to happen, and if they don't have the skills, we build the skills around them, we bring different parties together. Another key aspect of delivering research that we've got here in the Trust is engaging our service users and carers in helping us design research, helping us build research capacity, research skill, embedding their expert into that research activity within the Trust. So we have a cohort of individuals who are known as research partners, and we engage them. They work with us when we're working with colleagues, helping us to make sure that the studies are meaningful, are achievable, have relevance to our patient population.
My experience is if you want to pursue a PhD at Leicestershire Partnership Trust, then there's a supportive environment to do that.
It's been a great opportunity in terms of personal development, but also I think as development of the team that I work in. There's been a lot of hard work involved, lots of opportunities to do different things that I wouldn't have been able to do before. Certainly taken me outside of my comfort zone, thrown me to the far end of my comfort zone, but I'm reliably told that that's where the magic happens, and I do think that's true.
My first line of support was from my manager. When I approached her 3 years ago about my ambition to do a PhD, neither of us really knew what it would entail, but she was willing to support and signpost.
We'd be delighted to support any staff from any discipline, also enabling, who have a passion for research, who or maybe have an aspiration to be involved in research and don't understand yet what that might look like, how they may be supported.
I am enjoying my PhD. I think anyone that's done or doing a PhD knows that there are challenges along the way, but that's all part of the learning process. So I'm enjoying it, and I definitely feel it's helping me develop as a researcher, which ultimately is the whole purpose of it.
So as well as learning as a novice with research, really, as well as learning about all the different elements that are involved with research, with my own project that I'm doing, I've had opportunities to work with alongside researchers, to be involved with the clinical research academic network for East Midlands, meet with other clinical academics, and opportunities to attend a conference, complete poster presentations. I think that just names a few of the opportunities, really. And time is a really valuable commodity. So time to be able to read papers, to be able to really focus on the research and what I've needed to do for my own project.
So the next step for somebody who has completed a piece of research is to ensure they communicate that research. So we'll support staff to present at conferences or to write up a paper and to get that published, to get that in the public domain. So it's sharing good practice nationally and internationally. We will also help them look at what's next. So how do they influence back in their service area? How do they bring that knowledge? How do they bring some of those skills back to their services? But also, are they planning to do something else? Are they planning to do a further study? They may be planning to do a further higher degree, or they may be planning to collaborate with our academic colleagues and make sure that their service is active in research constantly.
I've received a great deal of support from the Trust, both from clinical members of staff and clinical members of staff of varying professional backgrounds, so psychiatrists, nurses, occupational therapists, pharmacists, as well as the research team that's based at Switzerland House. So I've received a great deal of support from members of the Trust of different backgrounds, as well as members of the Trust that also have links to the local universities, so University of Leicester and De Montfort University.
I also had really great support from our head of nursing, who has helped me operationalise how we actually going to make this work for me, because we've never done this before. And she's also supported me through the 3 years that I've been undertaking my PhD.
It's a fantastic opportunity. I have, to say I've loved every minute would be an understatement, but that's the same with any new opportunity. Would I recommend it? Absolutely, 100%. It's one of the best things I've done, probably in the last 20 years of my career. Really have learned so much individually, I've really pushed myself academically, realised I can do it, I'm not too old to do it, and you can learn, and I think the team around me have actually benefited as well from some of the things that we've actually put into place, and I feel that people have come along on the journey with me, and we've shared some of those experiences.